So for this case, we're going over excessive plantar flexion. So for all the phases that would be affected by this gait deviation would be initial contact, loading response, mid stance and terminal stance, and also all of the swing phases. The functional tasks that would be affected would be weight acceptance, single limb support, and single limb advancement. The task accomplishments affected would be shock absorption, forward progression, and stability. Some of the potential causes for this gait deviation could include things such as weak pretibials, right? So those are the muscles mainly associated with dorsiflexion. So weak dorsiflexion does not allow that foot to come up during the gait cycle, causing that forefoot contact to happen throughout most of the gait pattern. Another thing we could see is just lack of dorsiflexion past the range of motion. So if there's excessive stiffness that doesn't allow that foot to come up as well, you can also see that plantar flexed position. You could also see hypertonicity of the plantar flexors. If the plantar flexors are mainly taking over most of the work along the foot and the calf, you can see that abnormal positioning of the foot. And just to kind of throw it all together, you can also even see other things contributed through the gait cycle, such as excessive plantar flexion. Sometimes they use a swing to kind of get that foot out in front of them because it is basically like having a longer limb. You can also see some hip flexion and really restricted hip extension because of the length of that limb. So because of all these things, we can really see a limited heel rocker during initial contact and loading response. You can also have limited anterior progression of the tibia over the foot during mid stance and terminal stance, and also impaired foot clearance during initial swing and mid swing.